is one type of vitamin that is supposedly there to get rid of the numbness and the pins and needle sensation. But when taken in excess, can actually worsen neuropathy symptoms. That's why in this video, you will learn about vitamin B6 toxicity. Stay with me until the end. If you're currently having neuropathy symptoms, if you're currently into vitamin B supplementation, and if you're one of those asking if you should have B vitamins as a mainstay or maintenance vitamin for nerve repair, you will have all the answers in that video here. Hi, this is again Doc Sherry, Doctor of Physical Therapy. I'm glad to have you here. Many of you who have experienced numbness and pins and needle sensation will just immediately buy B vitamins or vitamin B complex in pharmacies. And if you happen to see the word megadose, or if you happen to see a brand with a higher dosage of B vitamins, you might think it's better because it will get rid of your symptoms faster. That is actually wrong, and that is a common misconception. But not everybody knows about vitamin B6 toxicity. Although it is true that you really need B vitamins for nerve health and nerve repair, there is one component that when taken in excess can actually give you neuropathy symptoms. I'm referring to vitamin B6, or otherwise known as pyridoxine. Look at this study here. Vitamin B6 is an essential vitamin for the building blocks of your nerve. It is a water-soluble vitamin, meaning it is considered generally safe because any excess will be flushed out by the body through our urine. However, there are rare instances of vitamin B6 toxicity. On average, the daily recommended dosage of vitamin B6 is between 1.2 to 2 milligram of vitamin B6, and we can get it from natural food sources like poultry, like fish, and like vegetables. However, excessive vitamin B6 supplementation can cause vitamin B6 toxicity, and it can give you sensory neuropathy where you feel numbness, burning sensation, and pins and needle sensation also in your hands and your feet. And some reported cases also include ataxia. There is incoordination when walking, there is loss of balance, muscle weakness, and even skin conditions. Now, here is what you're going to do. If you're currently taking B vitamins or vitamin B complex, I want you to check the label. Look for vitamin B6 or look for pyridoxine. Check the dosage. Now, this study here recommends the use of 50 to 250 milligram of vitamin B6 in treating conditions like carpal tunnel syndrome, where you feel the numbness in your hands. It is used to treat conditions like depression and even premenopausal syndrome. However, it is best to have a dosage of less than 100 milligram or 100 milligram of vitamin B6 per day, because this is the recommended upper tolerable intake as suggested by the American Institute of Medicine. Also, check with your doctor. Have a follow-up visit to really be clear on how long you should take your B vitamins. The American Neurology Association have recommended the right combination of vitamin B1, vitamin B6, and vitamin B12 in treatment of neuropathy symptoms. You do not need a mega dose for B vitamins, especially when we are talking about vitamin B6, because of what we call as vitamin B6 toxicity. You need vitamin B1 for the proper transmission of nerve signals in your body. Vitamin B6 is a crucial element. You need it as the amino acid in building your nerves, and vitamin B12 or methylcobalamin is needed for the myelin sheath or the covering of your nerves. Go for natural food sources. If you're already feeling better from your neuropathy symptoms, you can get it from natural food sources. With vitamin B1, you can get it from whole grains, from mungo beans, and even peanuts. For vitamin B6, you can have it from banana, from potatoes, and even chickpeas. And vitamin B12, you can get it from fish, from poultry, and lean meat, because we do not have a toxicity level with natural food food sources, and you need not supplement if you are eating well. You take care of your nerves naturally. If the cause of your numbness and pins and needle sensation is due to spinal conditions, say for instance, you feel the numbness in your arms because of cervical radiculopathy or due to sciatica, we have specific exercises that will greatly help you. Also, keep your blood sugar in check because this is the best way to control diabetic neuropathy. Now, here is the bottom line. You do not need a mega dose when we talk about B vitamins, especially vitamin B6, because there is what we call as vitamin B6 toxicity. You need not have vitamin B complex as a maintenance vitamin for nerve repair, because once you already feel better, you can have it from natural food sources. I will put the link of the exercises below. Just click on the video, that will greatly help you. Please comment down below where you are from, because I would really love to know. If you are suffering from numbness and pins and needle sensation in the lower leg and in your foot, but you haven't had your x-ray done yet, check this video here if the cause is due to an impinged nerve in your spine. Thank you very much for watching. I will see you on our next video.